Okay, hello and welcome to your session on some of the theoretical applications of surface electromyography. Now, let's start the session with a bit of a recap. It's nice, I think, to go back and just make sure that we're all singing off the same song sheet, seeing as I haven't seen you all in quite a while now. Now remember that surface electromyography is a technique that, and this is crucial, does not measure muscular force. I can't overstate that enough. It measures muscle activity, which I like to simplify and think of as the effort put into generating force, as opposed to the actual force output itself, which is the product of the effort. That's my simplified explanation for it. That's how I always understood it. Now, really what we're measuring is not so much the actual muscle itself, and this is what I think illustrates my original point very well. We're measuring the nervous activity in the muscle. So the nervous activity refers to the effort, if you like, and the actual force produced in the muscle is the product of that effort. So we need to understand and recap the basic origin of movement, which, as we know, is very much physiological in origin. It begins with the central nervous system. Some of you that have done anatomy for sport and exercise science will have covered this content, but again, a bit of revision for everyone, so we're all starting from the same point. Electromyography, as I say, almost is the cross bridge between physiology and biomechanics, but us biomechanists have stolen it for our own. Now, movement comes from various regions in the brain, but one of the most important is the motor cortex. Motor, whenever you hear that word, really refers to movement in human physiology and anatomy. And the motor cortex is this region here highlighted in red. So to the left hand side of the red region we have the frontal lobe, to the right we have the parietal lobe, and the motor cortex sits in the aptly named sensory cortex, which more or less does what it says on the tin really. It's involved in the receiving and processing of sensory information from your peripheral nervous system. But we're just interested in the motor component of the motor cortex. Now, excuse me, motor units, an individual motor unit is what we see here, a very crude graphical representation, but a motor unit, you'll recall, is the formation of a motor neuron, which is the blue lines here with the purple dots at the end, forming a synapse with a muscle fibre, which is another term for a muscle cell. When you hear the term fibre, it basically means muscle cell. And the nervous information is carried down from the motor cortex down through the spinal cord to our efferent neuron or motor neuron, and that activity or that action potential, I should say, is carried all the way down to the muscle fibers, and that will recruit the muscle fibers and will cause them to release calcium, go through cross-bridge cycling, blah blah blah, in order to produce force. So we're measuring with electromyography this nervous component. We're measuring these action potentials that are travelling down the motor neuron to the muscle fibre, and the more muscle fibres that we need to recruit, the greater the amount of action potentials that are required. The more motor neurons are required, the more motor units obviously are required, and so we'll see a stronger signal on our EMG output. So that's just a very basic overview, just a recap of some of the principles of what we're measuring here with EMG. But again, just to reiterate, not measuring force, measuring muscular effort, if you like, or neuromuscular activity would be a better way of phrasing it. Now this brings me on to Henneman's size principle. Again, a bit of a recap for some of you. Others, this will be a new concept. Henneman's size principle is one of the few principles in sport and exercise science that we can say with possibly greater than 99.99% certainty always occurs, and that's not often that we would say something like that. And it's fairly simple in its premise, but it's a very important principle to bear in mind. So here we've rather crudely highlighted all of the muscle fibers in your biceps brachii, or in a biceps brachii muscle. Obviously you'd have a few more than this, somewhere around 10,000 muscle fibers, but we'll make do with however many are on here, 20 or so. And just to keep things simple, we've stuck with type 1 slow twitch muscle fibers and type 2 fast twitch muscle fibers. Obviously there are type 2 A, B and X, but we're just trying to keep things simple here. Now, Henneman's size principle refers to the ordered recruitment of type 1 muscle fibers to type 2 muscle fibers. And this cannot be broken. So I've tried to illustrate that graphically here. If we engage a motor unit and that recruits a few muscle fibers, these will always be type 1 to begin with. Now, depending on the demands of the activity and the requirements on the muscle, there may be a certain amount of fatigue caused in the first few muscle fibers that we recruited, which may result in you needing a few more muscle fibers in order to continue performing the activity at the same level, whatever it may be. If the activity is one that fully fatigues and fully recruits all of the type 1 muscle fibers, only then will we go on to recruit our type 2 muscle fibers. And I've deliberately not highlighted that type 2 muscle fiber at the bottom right hand side there, just to illustrate the fact that we aren't able to recruit all of our muscle fibers altogether. And if you recall, we discussed this during your practical session a while ago, because this would never be advantageous in any situation. If you were to recruit every muscle fiber in your body during a particular activity or exercise, you would be completely and fully fatigued, which isn't advantageous for any athlete or any person. So your body will prevent you from recruiting them all, just so you've got a little bit left in the tank, as well, as it were, to perform movement should you need to. But Henneman's size principle is a robust principle, and it really does help us understand a lot about human movement. There is a lot of non-academic literature out there that suggests that you can skip type 1 muscle fibers and recruit type 2 straight away by doing this exercise or doing this combination of movements, whatever. That's not possible. It really isn't. With something like heavy resistance exercise, for example, if let's say you're doing your 1 rep max with a, I don't know, whatever exercise, let's say deadlift, the type 1 muscle fibers will be recruited and fatigued almost instantaneously, but they will still be recruited first. You can't break that cycle. And it's a very important principle to bear in mind, particularly for those of you that like resistance exercise and are involved in the training and performance-based aspects of sport and exercise science. So this brings us on to the innervation ratio of skeletal muscles. Now, innervation is not just coming up with new ideas. In terms of neurophysiology, innervation refers to a tissue. It can be any tissue in the body, doesn't matter what it is. It could be bone, could be skeletal muscle, could be your liver. It refers to it having a nervous supply. So a nerve has entered the tissue, gone into it, and the tissue is now considered innervated. So there are a few tissues in your body that aren't innervated. The connective tissue between your joints, for example, the cartilage, the meniscus isn't innervated because that would hurt as you start to wear away or even just compress the connective tissue over the course of the day. So we wouldn't want that, but muscles are very much innervated and they need to be in order to be recruited. So we have two muscles here. Let's call them muscle A and B, because that's what it says on the image. Now muscle A, you will notice, has, I should go back a step actually, these blue lines with the large dot towards the exterior of them and smaller dots interiorly within the muscle, are the motor neurons, and each large dot represents an individual motor neuron, and the corresponding small dots at the other end of the motor neuron represent where the motor neuron is synapsing with a muscle fibre. So you'll notice muscle A on the left hand side here has far more motor neurons than muscle B. However, muscle B has fewer motor neurons, but they are motor neurons that synapse with more muscle fibres. So you may wish to pause here and perhaps consider the reasons why that might be, why we have this variation in muscle fibres, or in innervation ratio, I should say. Again, for some of you this will be revision. Now, recall that each motor neuron will only synapse with one specific type of muscle fibre. You will never find within the body a motor neuron that is synapsed with 50% of the motor neurons it can synapses with are type 1 and the other 50% are type 2. That doesn't happen. They're either type 1 or type 2. Again, just for the sake of keeping things simple. So that's a bit of a hint as to what our original question was. So let's consider one of our large force-producing muscles here. This is the vastus lateralis. This is the largest of your quadriceps muscles. Again, you may wish to pause and consider which of the two muscles, either A or B on the right-hand side, the innervation ratio of the lateralis is most like, either A or B. And it is indeed B. Now, you might ask, why is this? Well, the lateralis generally has a higher proportion of type 2 muscle fibres. So these are the easy to fatigue or less fatigue resistant, you could say, but are able to produce more force than type 1s. And as we said, this is your largest quadriceps muscle. This is your largest knee extensor. It is your strongest knee extensor of all your knee extensor muscles. And it's its only task, more or less, its only function. It's a monoarticular muscle. It doesn't have a secondary role. It helps stabilize the patella, but other than that, it's really just trying to extend the knee with as much force as possible, to kick a ball, to run, to help you, I don't know, walk, run, jump, whatever. So having fewer motor neurons innervating the lateralis that themselves synapse with more muscle fibres means that you can recruit muscle fibres faster, which means you are able to produce force quicker. It means this muscle will have a greater rate of force development, and therefore that is useful with activities that require a lot, high force production and high power production and so on. Now, if we look at another muscle, and if anyone would like to guess at any prior, can't give you a prize, but I would if I was there. Any prizes for anyone who wants to guess the name of this muscle? You can actually palpate it if you extend your fingers and thumb and just apply a little bit of pressure with your other hand to the sort of fleshy region between your thumb and your index finger. It's usually a muscle that feels good when you palpate it, give it a massage. This is the abductor, the abductor pollicis brevis. It is an abductor of the thumb. So if you now bring your fingers and thumb back together, so they're all sort of touching, and move your thumb out to the side whilst keeping your fingers together, that is one of the roles of this muscle. This muscle, your abductor pollicis brevis, is more like the type, or more like muscle A on the left hand side of our two images here. It has fewer motor neurons, but it has more motor neurons, what am I saying, but each one of those synapses with fewer muscle fibers, and this is a muscle that generally has a greater proportion of type 1 muscle fibers. Now, why might this be? Well, this is not a muscle that is going to produce a huge amount of force. This is one of all of the muscles in your hand, wrist, so on, that are required for very fine, delicate activities, that are required for very fine motor activities, that require very refined movement, and need to be fatigue resistant. If in doing so, anyone that's ever been in a written exam, either at university or at foundation education, will know the worst thing in the world is to experience a cramp or fatigue in your hand when you're writing that you have to stop and shake out. But being able to recruit fewer muscle fibers, because there are more motor neurons, means that the muscle fibers are, or the muscle itself is more fatigue resistant. So for example, it's not necessary to recruit all of the motor neurons and all of the muscle fibers in order for this muscle to perform its task. If you refer to muscle A here, you may just want to recruit a quarter of those fibers, and then once they start to become fatigued, you could recruit another quarter of those, and let the original muscle fibers that you recruited recover. And this is called motor unit cycling, where your body cycles between motor units, where some rest whilst others are performing activity, and it's a way of fatigue resistance that your body is able to do. So muscles that are involved in very refined, very precise motor activities tend to have a higher innervation ratio, in that there are more motor neurons innervating the muscle, whereas larger force-producing muscles are generally going to have a lower innervation ratio, like the vastus lateralis. Okay, so are there any alternatives to surface electromyography? Yes, there are. Obviously, I wouldn't have put the slide on. And this is just a possible area of recommended reading for one of these techniques, because obviously there are some strengths and limitations that come with surface electromyography, but these two techniques that we have here represented graphically will certainly help overcome some of those, but they themselves come with their own alternatives. I'm not going to go into them in a great detail, but the technique on the right I will add a link to on Brightspace if you want to do some wider reading on it. It's a very interesting technique, but it is it's quite hard going. It's a heavy topic, but it's certainly something, if you are interested, I would recommend. So the needles that we have here on the left represent needle electromyography, which we have discussed in the past. Now, one of the real limitations of surface electromyography is that it is only able to assess the activity in superficial skeletal muscles, and by that I mean near the surface of the skin. So when we think of the quadriceps muscles, let's just stick with the four basic quadriceps muscles that we all know and love. The lateralis, the vastus medialis, and the rectus femoris are all easily accessible with surface electromyography. However, the vastus intermedius, which is underneath the rectus femoris, so directly in the middle of your thigh, centrally in your thigh, running from your patella all the way up to your hip, underneath there, although it doesn't actually attach to your hip, it's a monoarticular muscle, is the intermedius. We can't access this muscle, so we can never get a true representation of all of the quadriceps muscles, which is a huge limitation. So how do we overcome this? Well, you could use needle electromyography. I wouldn't want to, but you could. I know we've touched on this before, so we won't go into it in great detail, but needle electromyography is, well, you can guess. It's where you insert a needle into the limb and into the muscle of interest, and you can measure the activity of the muscle in that area. And it otherwise functions exactly the same. Instead of using sensors, it uses a needle to pick up on the activity. It hurts. You can't do any strenuous physical activity because the needle might break. There are wires connecting you to the PC or laptop that the assessor may be using, so you can't move around too much anyway. It's mainly used in clinical settings to assess the progression of conditions like ALS or motor unit disease, well, motor unit diseases, there are several actually, and assess the progression of those conditions. It doesn't generally get used in sport and exercise science for reasons we've covered, but it does overcome the issue of only being able to assess superficial muscles. The technique we have illustrated here on the right hand side here, which again I won't go into great detail, but I will put a link on for if you're interested in it, is called mechanomyography. Now, mechanomyography again measures muscle activity, but in a very different way. It looks to measure the vibrations caused by the muscle as it moves, as it is engaged. There are various studies out there that compare the pros and cons of these techniques. It's not as commonly used. It's growing in popularity, but it's a technique that we don't see. I don't know too many places that use mechanomyography in the UK, but it's certainly growing in popularity. As I say, we won't dwell on that, but it's certainly something, if you're interested, I'll put a link up for you to read on. Okay, so there are a plethora of applications of surface electromyography. It can be used in a huge range of areas, and we're not going to cover all of those, but this is just a few of them. So prehabilitation being the prevention of injury, identifying injury risk factors, which is, I suppose, a subdivision of prehabilitation, selecting appropriate exercises, so you can assess the muscle activity in response to different exercises and therefore pick the exercise that has the greatest recruitment of that muscle. So on the theory that the greater the muscle activity, the greater the muscle recruitment, and hopefully the greater the hypertrophy you would see in response to that activity. It can be used in more clinical settings to assess things like posture, balance, fall prevention. We can also look to try and understand fatigue. Fatigue is a concept you may have covered in physiology, I'm not too sure off the top of my head, but it's a very hard term to define, because at what point are you truly fatigued? So looking at muscle activity during fatiguing activities is a great way of understanding this phenomenon. And basic motion analysis. When you think about it, forces produce movement. Kinetics causes kinematics. So we can assess our kinetics, our force element of motion, using the isokinetic dynamometer, force plate. There are a couple of other techniques which we'll come to learn about as we progress through the course, but those forces then produce movement, which we can assess with our camera system, whether it be 2D or 3D. But again, the benefit of electromyography is that you are assessing the origin of that movement, the individual muscles that are contributing to that movement pattern. And that's a crucial component of understanding human movement, because it completes the picture, if that makes sense, of what's actually going on here, what's causing this movement to occur. And without it, we would never really have a full understanding of human movement. So it's an important technique. There are other applications, as I say. It's one of the great benefits of this technique is that it can be applied in so many different areas, and it's an incredibly useful technique. That does come with the phrase that I believe I've used with you before, but if not, I'll just recap here that it is a ubiquitous research technique in that it can be applied to so many different areas. But because it's very easy to use, it is very easy to abuse, and some people, within a day, you can understand the basics of electromyography. It is a very complex technique if you want it to be. There are some review articles and research articles I could put on Brightspace for you that would, well, they horrify me. But the principles of EMG, the basic principles are very basic, very straightforward, but because of that it's easily abused, as the term says, easy to use, easy to abuse. So it's a technique that requires a lot of experience and a certain amount of training to really get the hang of. As I say, you can learn it in a day, but that doesn't mean, a bit like chess, you can learn chess in a day, that doesn't mean you're a master of it. Right, so gait development. This is, I think, a fascinating area of EMG analysis. So there have been studies done that have assessed muscle recruitment at more or less every age from 1 to 85 years and looked at the change in muscle activity as we walk. So on the right hand side here we have the muscle activity of or an example of an activity in an 85-year-old. On the left we have the example of muscle activity in an infant learning to walk around about 1 year old. Excuse me. If you look along underneath the image of the two characters walking, you'll see TO and HC. So TO is toe off, HC is heel contact. The child example is foot contact because they're learning to walk. They're not using their heel. They're just getting their foot in contact with the ground. Down the left hand side you have the abbreviations of various different muscles. So TA is tibialis anterior, LG would be lateral gastrocnemius, VM vastus medialis, RF rectus femoris, BF biceps femoris, and GM gluteus maximus. So this is just a typical gait cycle of a 1-year-old and an 85-year-old, and there are similarities, very broadly speaking, not looking at individual muscles, but just in general. It's said that when we're learning to walk, we apply a all or nothing approach to muscle recruitment. We just recruit all of the muscles as quickly as possible to stabilize, to move the limb, and try and maintain our balance, and it's very unrefined, it's very uncoordinated, and it's like learning any skill. You could take the image here of muscle activity for the 1-year-old and, forgetting what type of muscles they're assessing, apply that to you learning any new motor skill. You would recruit far more muscles with a greater magnitude when you're learning a new motor skill. Say you're learning to juggle, say you're learning to ride a bike, say you're learning any new activity. Your motor unit recruitment will be far greater, and this of course causes fatigue. This of course means that it's going to be harder to do, and the same is true in the 85-year-old example here. You see the gluteus maximus, biceps femoris, huge amount of recruitment, both recruited simultaneously, trying to extend the hip and move the body forward. So from heel contact onwards, most of the muscles, apart from the tibialis anterior, recruited to a very high degree. Likewise with the infant, large amount of muscle activity here. There's no real pattern, you can't see a trend in what's going on. However, if we were to bring in an example from a 29-year-old, you can start to see individual patterns of activity. So we see the tibialis anterior is recruited for a brief period between toe off and heel contact of, this is obviously between the contralateral limbs, and once the tibialis anterior switches off, the lateral gastrocnemius comes on. There's a small, very brief area where the medialis is engaged, the rectus femoris is engaged at 4 specific, very discrete moments in the gait cycle. You get the idea. The recruitment is very specific, and it is very discrete in terms of the activity. It only occurs when it's absolutely needed, and this is because we've mastered walking, hopefully, by the time we're 29 years old. We don't need to recruit all of these muscle fibers, and it means we are obviously going to be less fatigued by performing this very basic of motor skills, and it improves our movement economy. The more refined the EMG signal becomes, the greater your movement economy, which is obviously crucial to what we want. That's when you're learning a new technique, you're basically trying to get from either the 1-year-old or the 85-year-old muscle activation pattern to the 29-year-old and even beyond, because you're trying to go from this all or nothing approach, just recruiting everything, just trying to get the movement done, to performing the activity, the same activity, but with less motor unit recruitment, less muscle recruitment, because you're better at the movement, if that makes sense. So let's move on. I should add, we will, as sort of to keep in tradition, we'll have this video will be 45 minutes long-ish, so feel free to have a break and then move on to the next video. Okay, so let's look at muscle activity and EMG analysis in a couple of other scenarios. So let's consider the hamstrings muscle group. We have 3 different muscles which all originate from the same region but insert on different areas. So This is the semi-membranosus. So the origin of the muscle is up on the pelvis here. This is called the ischial tuberosity, and it inserts down on, you can just about make that out, on the medial side of the tibia down there. So this is the semi-membranosus. So this is the deep part of your hamstring muscles. On top of this, the more superficial muscle is the semitendinosus. We refer to these collectively as your medial hamstrings. Now this is a very brief area of controversy in hamstring EMG analysis. There are those that say you can assess the activity of the membranosus, and there are those like myself that say, well, you can't because the tendinosus is in the way. And you can't say with any certainty that you are definitely getting the activity of the membranosus. How do you know you're not just recording the tendinosus? And we refer to this phenomenon as the crosstalk phenomenon. And it's perhaps best illustrated or described when talking about the activity of the pectoral muscles. Measuring the activity of your right pectoralis major isn't an issue. However, the left pectoralis major, we often get crosstalk from the heart, the cardiac muscle tissue, and that's where the sensor is simply picking up on the activity of another muscle underneath or deeper to the muscle of interest, and it's very difficult to isolate the activity of one specific muscle, which is why with EMG analysis you'll often see researchers play it safe and say, well, medial hamstrings and lateral hamstrings. So medial hamstrings just referring to the membranosus and tendinosus together. We won't say with any degree of certainty how much activity each individual muscle is contributing. We'll just say we'll group them together as one. And then we have the lateral quadriceps, hamstring muscle, the biceps femoris, which does actually have a smaller monoarticular head. Again, the biarticular hamstrings all originate from the ischial tuberosity on the pelvis there. The biceps femoris attaches down on the fibula, which you can just make out, but if you look up the right hand side of the muscle you can see this other small bulge. This is the smaller head of the biceps femoris, which is monoarticular. It doesn't really have a huge influence on movement, but it is nonetheless a monoarticular hamstring. Now, this brings us on to another possible issue with EMG analysis, and I'll upload some studies on the Brightspace about this. Now, your hamstring muscles are one of the longest muscle groups and individual muscles in your body. So if we place a single EMG sensor in the middle of this muscle, as we're supposed to, the middle of the muscle belly, how can we be certain that we're getting the activity of the whole muscle? Because we've just got this sensor placed in the middle. And there are some studies out there that have, for example, let's go with the biceps femoris, that have placed two EMG sensors, one higher up or proximally and one lower down, distally, both on the biceps femoris, and compared the activity between the proximal and distal regions of that muscle. And moreover, there are physiological studies that have shown that your hamstring muscle group and quadriceps also will undergo site-specific hypertrophy. So hypertrophy might not necessarily occur evenly throughout the entirety of the muscle. Some activities may engage the muscle proximally, some maybe distally, therefore the muscle may grow or experience hypertrophy proximally or distally. So you might see a greater extent of hypertrophy nearer the origin or nearer the insertion. And this has been shown. So it's an important point to consider when assessing the activity of long muscles, essentially, like hamstrings and some of the quadriceps muscles. Now, EMG analysis has helped us understand hamstring injuries significantly, and hamstring injuries are arguably the most common injury in football. It tends to be either hamstrings or ankle injuries. For those of you that are footballers, you can perhaps relate to this. I'm not, so I will just go with what the literature says. Now, using our EMG analysis, we've been able to understand that when performing an instep kick here, as this person is, if we just lay over a basic free body diagram, the hip on the side of the kicking limb has gone into flexion. So if you think of the position of the thigh relative to the thigh of the contralateral limb, which is in contact with the ground, this is now in flexion. There is about 40 degrees flexion, I'd say, between the limb on this person's right side and left side, more or less, and the knee is almost at full extension, almost. Now, as we know, the hamstrings is a biarticular muscle group, as we can see in our previous image. And this is shoot myself in the foot here, but it's a knee flexor and a hip extensor, but you can see it doesn't actually cross the hip joint, the acetabulo-femoral joint, which is the anatomical term for the hip joint where the femur articulates with the pelvis. It doesn't actually cross it, but nonetheless it does exert an extensor force and moment, I should say, over the hip. Despite the fact it doesn't actually cross it, it still acts as a hip extensor, but it's a weak hip extensor, and that's why, because it doesn't actually cross the joint. But what we've been able to understand is that from 90 degrees flexion, more or less, through almost full extension, the biceps femoris tends to be engaged when we're in a position like this, where we have one limb flexed, one hip flexed and not the other. And this force that's being produced is an eccentric force. It's a braking force. It's trying to prevent the knee from overextending. And indeed the hip to a certain degree. It's trying to prevent injury, it's trying to decelerate the limb. You've kicked the ball, this guy's produced enough force on the ball to get it moving. Now the hamstring's just trying to prevent any hyperextension of the knee or hip. And the biceps femoris does the majority of the work, but what we've been able to understand is that the semimembranosus is engaged for the last portion of knee extension. So where this person will move from this position to full knee extension, that is the membranosus that is fully engaged, well, not fully but near as, from this point onwards, from just about 15-20 degrees flexion to full extension. And this helps us understand why that footballers who suffer hamstring strains suffer strains in the semimembranosus and sometimes the tendinosus, but not the biceps femoris. The most commonly injured hamstring muscle for more or less everyone else will be the biceps femoris. But in footballers, it tends to be the membranosus and sometimes the tendinosus, which is more commonly injured. And that is simply because the semimembranosus is providing an eccentric force just before the limb reaches full extension. We'll talk about a bit more about the differences in muscle recruitment as we go on. In fact, I think this is a perfect time for a break, so if you have 5 minutes before moving on to the next lecture, now is the time.